Please summarize your chosen approach to family therapy.
As a structural family therapist, we believe that adaptive family functioning is a concept that encompasses the family structure, its subsystems, and of course boundaries. The premise of the theory is that the family is made up of roles, rules, and power. Structural family therapy was first developed by Salvador Minuchin, who was a Russian immigrant who lived in Argentina. As a medical doctor in the Argentinian army, he grew an interest in psychology and began to study psychoanalysis when he came to the U.S. At the Wiltwyck School where he worked was when he became interested in systems theory and began working as a systems therapist. Working with lower socioeconomic level African American families, he realized that traditional family therapy approaches just weren't working well with that particular population. So he began to develop a new method with colleagues that focused on boundaries, disengagement, and enmeshment, what became known as structural family therapy as we know it today. In general, Minuchin's theory is quite pragmatic in the sense that it mainly involves individuals interacting within their environment. So according to Minuchin, every family has a structure that's revealed whenever the family is interacting with each other. So this structure can either be adaptive or maladaptive. It's about finding a happy medium and the amount of structure within the family. Too little structure, too much structure can cause rigidity, stress, or dysfunction. Open and appropriate structure is what we as therapists aim for so that families can recover more quickly and become more functional as a unit.
What makes your chosen approach distinct from other approaches to family therapy?
Structural family therapy is very versatile. It can be used with various populations. In today's society, it's very important to focus not only on heterosexual nuclear families, but other types of families as well. Therapists need to work with a variety of families, including blended families and same-sex marriages and families, single-parent homes, etc. So the method is also applicable with culturally diverse populations. It's important for therapists to have the tools necessary to work with those diverse groups. As structural family therapy was first developed specifically for lower socioeconomic families, it fits well with diverse populations, whether you're working with lower income families or middle class families. It's also been shown to be effective with several client difficulties such as juvenile delinquency, alcoholism, obesity, and anorexia. Also, in comparison to other models of family therapy, structural family therapy is very easy to follow for most therapists, including those who are new to the field. Despite the name, it's not as structured as other methods. The methods and techniques used in structural family therapy is very clearly written. Structural family therapy is also recognized among medical and psychiatric specialties as an effective approach to helping client families cope in stressful situations. With its emphasis on problem-solving skills, it helps families to take steps toward conflict resolution beyond the therapeutic experience.
What drew you to this approach personally?
I liked the simplicity of the structural family therapy approach. The approach doesn't have a lot of rigid guidelines for the therapist, which allows the therapist the flexibility to add in their own personality as well as what best fits the family unit. Many of the other family therapy theories are very much more structured and complex without allowing the therapist to be flexible, and in my opinion, helps the therapist appear more sincere to the client, ultimately strengthening the therapeutic relationship. Structural family therapy helps the therapist to be more influential in the changing process. And as a therapist, I feel homework can really be helpful in therapy. Structural family therapists assign homework to families, which aid in the continuity of the therapy sessions so that there's not so much of a break between sessions and the therapy continues at home as well.
Can you describe any key interventions associated with this approach?
Well, for one, To address dysfunction, structural family therapists use interventions such as joining and other techniques such as disequilibrium techniques. Joining is the process of coupling between the therapist and the family, leading to the development of a therapeutic system. One technique that the therapist might use to join with the family is tracking. This is similar to reflecting, only the therapist is relaying the facts of the content the family has already expressed. A second technique is mimesis, where the therapist adjusts their mannerisms and way of speaking to match that of the family so that the family is accepting of the therapist. For example, if a family member is the type to joke around a lot or use humor, the therapist can then join in the humor as well. Or if a family uses metaphors a lot in their dialogue, then the therapist can expand using metaphors as well to describe their interactions. Confirmation is another joining technique that's also similar to reflecting, but in a non-judgmental way that reflects verbal and non-verbal expressions. For example, a therapist might say, "I noticed you were looking down when your wife spoke about her feelings toward her job. Is this related to some emotions that might be contributing to the discord in your relationship?" The last joining technique is accommodation, where the therapist makes personal adjustments to strengthen the therapeutic alliance. So if you're working with a child in a family and the child prefers to sit on the floor, the therapist might also choose to sit on the floor when speaking with the child. Another type of intervention is disequilibrium techniques, which are used to change the family system. There are several techniques that fall under this category, so I'll expand on a few. The first is reframing. Reframing offers the family a different point of view by reframing the question. Enactment is also an important technique used by the therapist to encourage family members to interact with one another through acting out typical scenarios when experiencing family conflict. To alter rigid or permeable family structures, the therapist uses boundary making to help make boundaries either more flexible or less flexible. Punctuation includes selecting a portion of the family's dialogue or actions that accentuates one of the therapist's goals. So for example, if the family is having difficulty interacting and the father is specifically having difficulties with his teenage daughter, the therapist would make a comment highlighting the father's attempt at participating in a new activity with his daughter. Using unbalancing, the therapist takes a unified stance with one member of the family against the other members. So, in other words, the therapist takes sides with the family scapegoat, if you will, for those who are familiar with strategic family models, or assist the underdog in order to help the family adjust their roles and functions within the family system. One of the main techniques used in structural family therapy is restructuring. This is where the therapist attempts to alter the existing hierarchy in the family and the way the families interact with each other. The therapist might also use intensity with client families. Here the therapist uses strong affect or prolonged pressure to raise the intensity of the statements to encourage family members to interact with each other and break down maladaptive patterns. There's also spontaneous interaction, which is a way for the therapist to focus in on family dynamics and certain behaviors of family members in order to help the family better recognize maladaptive patterns within the family and foster modifications in the family dynamics. Diagnosing the family is a type of mapping that allows the family to have a visual of what the family boundaries are and how they relate. These may be viewed through rigid or diffuse boundaries. In families with conflict, for example, it would often display as triangulation in the mapping. Or it could display how children's privileges and responsibilities are too advanced for their age group in families with parentified children. Also, adding cognitive constructions is also useful to the therapeutic process. These are verbal components given by the therapist. Cognitive constructions include advice and information, which is meant to calm and reassure family members by normalizing their situations. It also includes pragmatic fictions, which are essentially reality checks for family members. Here, the person gains insight through honest comments made by the therapist. Another cognitive construction is the controversial paradox, which is a technique meant to cause confusion and frustration by telling the family they should not change and to continue behaving in the same fashion that they had been prior to the session. This is somewhat likened to reverse psychology because it's meant to make the family members defy the therapist's suggestions but change for the better. Another technique used by structural family therapists is shaping competence. And here the therapist attempts to highlight appropriate interactions between family members, which is a form of positive reinforcement, really, when the parents or children demonstrate it during a session. So for example, if the wife is visibly upset and the husband turns to her and attempts to comfort her in some way, the therapist can underscore the husband's appropriate actions if this has been a traumatic pattern in the relationship.
How would you describe this approach in one sentence?
Well, structural family therapy is non-traditional, action-oriented, and a simplistic way of creating balance within the family structure by emphasizing roles, rules, and power within the entire family.
Okay, thank you.